makes the difference of policies? Thank you.
Thanks for the question. I will begin. So yes, I think what we're seeing is that a number of countries are taking a risk-based approach to the interventions that need to be used and applying them where and when necessary. So you mentioned Beijing lifting one of their tools that they are using. For this, in this example, the use of masks. And masks are one of the tools that can be used in the control of this pandemic, controlling of transmission of the SARS-CoV-2 virus. And then you mentioned another country. And so I think what we are seeing is that what countries are doing is that with the surveillance that is taking place, where they are actively looking for cases, where they're using public health measures such as isolation and clinical care for cases, contact tracing and quarantining of contacts of known cases, the use of masks where appropriate, physical distancing, good information. Countries are collecting data. And what they're doing is they're using that data to help advise them on what needs to be done next. Can some of these measures be lifted, or do some of these measures need to be implemented again? And countries are at different stages of the pandemic. And so while many countries are seeing success in suppressing transmission, breaking chains of transmission, they're able to lift some of these measures. And in other countries where measures have been lifted and they're seeing a resurgence in some areas, and we've seen in a number of countries that there are clusters of cases that are happening where people are coming together and congregating, some of these measures need to be implemented more strongly again. So we need to expect this. All countries need to expect this. And we need to continue to use the tools that we have right now, which include active case finding, contact tracing, the use of masks, physical distancing, respiratory etiquette, hand hygiene, and then applying measures where and when necessary. We are very hopeful that countries will not have to impose nationwide measures, but could impose some perhaps smaller, more geographically bound, time-limited bound interventions where they are most needed to get through any resurgence in cases.
Thank you very much, Dr. Van Kerkhoff.